Hi, I'm Heather Campbell, Executive Director of the Advocacy Center. It has been another extremely busy month for our staff. This spring we predicted that once restrictions started to ease that we would see a surge in need in our community, and that has very much been our reality. June was very busy for our staff, and July was even busier. In fact, our hotline was incredibly busy in July. Our call volume was over 50% more than in July of 2019, which is really a tremendous increase in terms of the number of calls that are coming to our hotline daily. This increase in calls has definitely stretched our staff, many of whom are still working remote or working part-time in the office and part-time remote, but has also stretched our technology. To respond to this need, just this week and next week, we're going to be implementing a new hotline system and moving our hotline to a more modern system that will allow us to answer more than one call at once and better manage the flow of calls. And we really think this is going to provide a better experience for survivors of domestic and sexual violence who are calling our hotline. There's been a lot of work by our administrative staff to plan and test this new system. We're really relieved that we were able to make this change now, and we thank the Community Foundation's COVID Relief Fund for the financial support to make this change now when it was needed most and not in 2021 when we had anticipated making this change. I also have an update on our new clinical therapy program. We're happy to announce that we've been able to work through the last of the administrative details for our new youth and family therapist to be able to start seeing clients. This is our first clinical therapist person on staff, and we'll be able to provide free trauma-informed therapy for youth victims of sexual abuse and their non-offending family members. This fall, we'll be hiring a second therapist who will work with adult survivors of domestic and sexual violence. We'll, of course, continue to work with our mental health community partners. Two therapists will not nearly fill all the need of the survivors we work with, but these therapists will help survivors who have barriers accessing other services and be able to provide critical, time-sensitive, trauma-informed, evidence-based therapy to people who have a really high level of need. There's so much more happening at the agency. Please click on the other links in this email for more information about what our hardworking educators have been up to and how they have dealt with having to really change much of what they do in their daily work to make sure that the education and outreach is still happening in our community. You'll learn more about our upcoming 5K walk run, which is really going to be fun, and also our staff spotlight. And so thank you so much for your support. Thank you so much for your emails, for your donations, for your gifts, and for caring about the work that we do and survivors in our community.